Absolutely. I mean, the classic one is the myomectomy, which is essentially just a big name for removal of the fibroids. That's been the mainstay for years for most people and most surgeons. And depending at the time of life that woman's in, that would be the treatment of choice. So typically, it's an open myomectomy, can be done robotically. Now we can do them, and laparoscopically they can be done. There are two other means of trying to manage that. The radiologists have gotten into the game now, as you may or may not have heard of uterine artery embolization. Nice term. They get about 5 times as much money for that procedure that we do for ours, but that's okay. But it's they go in and essentially they find the artery that feeds the fibroid, and they clot it off, and that causes that fibroid now then to degenerate. The nice thing about that is they take care of that, and then when the patient comes and has all the pain and discomfort after the surgery, they call the doctor, the gynecologist, and say, "What am I going to do?" So anyway, so I love that, But I don't, I really, it's as nice of a procedure as it kind of sounds like. In this area, I have not seen a tremendous number of people doing it. Okay, and then obviously the other thing is Lupron. That's used primarily to put you into a medical menopause. So anytime we drop the estrogen levels down, drop your hormones down, that tends to cause the fibroids to decrease. The problem with that is once you stop the medicine, they will then start to grow again. Same thing in pregnancy, because you have so many hormones circulating, you got so much more blood circulating into the uterus during that time, the fibroids tend to get a little bit larger. So those are the kinds of management schemes that you have. But it's classically, most have been done, usually surgical removal has been probably the biggest thing. Now, yeah, you probably have heard about this whole thing about, morcellation and trying to take the fibroids out in total, or not taking them apart like we used to. And so that has changed things a little bit in terms of how we manage them once they've been removed. But that's still the mainstay. We want to take them out typically. The real challenge is probably in a woman who has infertility, and whether or not, and so she has infertility and she has fibroids, and the question is, will the removal of the fibroids really make a difference for her? In some cases it does, in some cases it may not make a difference at all, but that's always a challenge, because you never want to go in and destroy or tamper with the uterus in a woman who hasn't had a child and then make it more difficult for her to have it afterwards. So it's always kind of an act of, well, should we try to be conservative or more aggressive? And that's a kind of a difficult decision. But for most women, they take them out because they usually have gotten so large, or their bleeding has gotten to be so tremendous that they I have to do something. And other women who just don't want their uterus removed. They say, I don't mind, taking the fibroids, but God gave me my uterus, I'm going to take it with me.